Are you finding your feet jumbo-sized and swollen up by the end of the day? Finding it harder to fit into your shoes or finding it harder to tie your shoes? Welcome to yet another common pregnancy discomfort, swollen feet and ankles. So hello everyone, I'm Dr. Anjali Kumar. I'm a gynecologist and obstetrician. Once again, I bring greetings to you from Maitri. Maitri is a space where we talk anything and everything about women's health. So have you heard of a common Hindi saying, "Pair bhari ho gaya," which means that feet have become heavy. It's a common lingo in India to say that a woman is pregnant. So let's understand today what makes the feet and ankles become heavy and swollen in pregnancy. Is it serious, and what can you do at home to take care of this? What causes the swelling of feet and legs? Medically, it is called edema. It affects 3 in 4 pregnant women. Though it commonly starts in the late second trimester, it can start as early as the first trimester also. It tends to become more severe as the day progresses and seen more in warm weather. It is more severe in case your weight gain has been on a faster and higher side, and it is more obviously in case you are carrying twins. Due to pregnancy-related hormonal changes, the water content in your body increases. This extra water goes towards the growing baby, placenta, amniotic fluid, and towards increasing maternal blood volume. The growing uterus also exerts pressure on the pelvic veins and your vena cava. So what's vena cava? It's the large vein on the right side of your body on the back that returns blood from your lower legs to the heart. Now the big uterus obstructs the blood flow back to heart, thus pooling the blood and the fluid in the lower limbs. So we spoke about this in detail in our video on what's the right sleeping position in pregnancy. So do watch that also. Is the swelling of the feet and ankles serious? No, not really. Most of the time it's actually harmless. However, if your face becomes puffy, if you notice more than 2 kgs of weight gain in 1 week, or if the swelling persists for more than a day at a time, which means it does not improve overnight, please report this to your doctor. Excessive swelling can be one sign of preeclampsia. It's a serious complication in pregnancy where the mother's blood pressure becomes high, kidneys are leaking protein in urine, and there could be serious effect on the health of the baby too. Rarely, the swelling in the legs could be a sign of deep vein thrombosis, DVT. It's a potentially life-threatening condition which occurs when a blood clot forms in a deep vein. Swelling from the DVT tends to affect usually one leg only, might cause a feeling of heaviness when you stand up, might cause pain in the calf when flexing your foot, or cause the skin over there to become red or warm to touch. Rarely, the sudden swelling of the feet could be a sign of an undiagnosed pre-existing cardiac condition. In that case, the swelling will be associated with other symptoms like difficulty in breathing or pain in the chest too. So what should be done for the swelling? Obviously, your doctor would first investigate if the swelling is normal and there is no serious reason behind this. So today, let's talk of few home remedies you can do to take care of this. Number 1, reduce sodium intake. One way to reduce swelling during pregnancy is to limit your sodium or salt intake. Salt makes your body hold on to extra water. So try to avoid canned or processed foods as these are especially high in sodium. Also try not to add extra table salt on your food like on salads, curd, raita. Avoid pickles, chutneys, high salt cheese, finger chips and street food. Second, increase potassium intake. Not getting enough potassium also can make the swelling worse. This is because potassium helps your body balance the amount of fluids it holds onto. So try to include foods which are naturally high in potassium, like potatoes with the skin on, sweet potatoes also with the skin on, bananas, spinach, beans, some fruit juices like pomegranate, orange and carrot juice, beetroot, yogurt, lentils. Third, reduce caffeine intake. Now, while occasional caffeine during pregnancy isn't that harmful, drinking too much caffeine isn't considered great in pregnancy. It can also make your swelling worse. Caffeine is a diuretic which causes you to pee more, which then makes your body think that it needs to hold onto fluid. Drink more water. Now you might think, how would this work? If your body thinks you are dehydrated, it will hold on to even more water to try to compensate. So try to drink at least 10 glasses of water every day to keep your kidneys flushing out the bad stuff and to keep your body well hydrated. You can flavor your water with lemon, mint or orange peels to make it more enjoyable. Elevate your feet and rest. Now, this is the law of gravity. Sitting with your feet elevated for a little while in between during the day and especially at the end of the day can help drain all the fluid that has been pooling in your legs throughout the day. Try flexing your ankles up and down, rotating your feet and moving your toes while you keep your legs elevated. You can even permanently slightly elevate the foot end of the bed by keeping pillows under the mattress. Sleep on your left hand side. Sleeping on your left side whenever possible can improve the blood flow, which reduces the swelling of the feet. Wear loose and comfortable clothing. Wearing tight clothing, especially around your waist and ankles, can make the swelling worse. Basically, it keeps the blood from circulating as easily as it could. Try to wear loose and comfortable clothes or at least avoid tight elastic bands, for example, in your socks. Maternity maxi dresses in the summers and flowing cardigans or sweater with jogger pants in the winters can both look smart and comfortable. Wear comfortable shoes. Wear well-fitting, comfortable shoes in pregnancy. Avoid high heels and avoid totally flat shoes too. Block heels are safe and great to use. Right footwear will reduce the swelling and also prevent the backaches, hip pains and leg pains in pregnancy. You might need to buy 1 or 2 new pair of shoes as your old beloved shoes might not fit now, but this is an excellent excuse to find some new favorites also. Wear waist-high, not knee-high compression stockings. If you have persistently swollen feet or you have to be on your feet most of the time, you should wear waist-high compression stockings. Now these stockings gently squeeze your feet and legs to help keep the fluid circulating. Try to avoid the knee-high compression stockings as they may be too tight in the middle of your leg and can actually make your swelling worse. Stay cool. Now by that I mean to stay cool temperature-wise. So swelling of feet and ankles tend to be more in heat or summer months. So staying indoors during the heat of the day during summer months and avoiding vigorous exercise can help you keep cool and reduce swelling. Putting your feet in a hot water tub to reduce the swelling is not a good idea and can actually make it worse. If you love swimming, try that. Many people do find relief from the swelling when they spend time in the pool. So if you love water, do spend time in the pool. You will feel lighter and cooler, plus get a little exercise and you may find that your feet and legs are less swollen. Walk. Walking is one of the safest pregnancy exercise which can improve circulation and reduce swellings. Walk at least 15 to 20 minutes once or twice a day. get a massage. Massage helps circulate the fluids that tend to accumulate in your feet, which will in turn reduce the swelling. You can do it yourself, ask your husband to help, or take a prenatal massage. Anyway, it's going to be a great stress buster too. What are the red flag signs to watch for? Which means you must report to emergency room if you notice any of the following signs with the swelling of the feet. Number 1, sudden swelling of your hands, feet, face, or around your eyes. Swelling that gets dramatically worse. Dizziness or blurred vision. Severe headache. Abdominal pain, especially in the upper right hand side of your abdomen. Mental confusion. Difficulty in breathing. Before you know it, your shoes will fit you again, and the only feet you will be focusing on will be those tiny baby toes. So till then, enjoy your pregnancy, enjoy our pregnancy videos. Trust Maitri to give you the scientific, latest, medically authentic information about women's health. And do not forget to like, share and subscribe to Maitri if you have not done it already.